Leukemia. What's happening in your blood?
Leukemia is a type of blood cancer that develops from the bone marrow. A trigger mutation drives the bone marrow to produce abnormal white cells, which are called blasts. These immature white cells tend to grow in a rapid rate, and that basically leads to overcrowding of the blasts, leading to reduced production of normal healthy cells. And where you have this imbalance between increase in blasts and reduction in healthy cells, that leads to basically complications such as anemia, infection, and also bleeding. There are different types of leukemia based on, number one, the rate of the progression of the disease. So you have acute and you have chronic. Acute means the speed of the disease progressing, versus chronic is a slow growing cancer. The two types of acute leukemia, basically acute lymphoblastic leukemia and also acute myeloid leukemia. Now, acute lymphoblastic leukemia usually occurs in children. However, it can also occur in adults. These are very rapidly progressive leukemia, which requires urgent treatment. Now, with regards to acute myeloid leukemia, this usually occurs in adults, and this is also rapidly progressing, should be picked up early so that appropriate treatment can be initiated. In terms of chronic leukemias, we have chronic myeloid leukemias and also chronic lymphocytic leukemias. So chronic myeloid leukemia usually happens due to certain mutations, for example, Philadelphia chromosomes. Now, in this current era, there are revolutionized medication that basically helps to treat CML very effectively. At the same time, CLL, or chronic lymphocytic leukemia, often occurs in adults in an older age group. It's a slow-growing tumor which needs to be monitored closely to evaluate the indication for treatment.